Kusampala and welcome to this program. Today, coinciding with the World Mental Health Day, we bring to you a very special program, and it is on the mental health issues here in Bhutan. Um, it is very important, I think, to understand what mental health is all about, and it is also important to know what we are doing, where we are failing, and what is the way forward. So I think mental health issue has become a big cause of concern today, and it has become an important issue, important topic that every one of us should talk about seriously. So today in this special program, I'm joined by Dr. Will Parks, the UNICEF representative of Bhutan, and he leads the agency in the welfare of the children here in the country. So firstly, I would like to thank you, Doctor, for joining the show. As we always think, mental health issue in Bhutan has become a very serious issue. So firstly, before we talk about any other issue, firstly we would like to know, what do you think about the mental health status in the country?
As we know, globally, mental health issues are a problem and a potential solution in every country. So every country, every society around the world deals with mental ill health and suicide, but also mental health promotion. And Bhutan is no different to that, and is one of dozens and dozens of countries around the world grappling with the mental health challenges of our time. What I think is really important is the way in which Bhutan has, as a country, responded to the COVID pandemic so successfully. But of course, a pandemic of this kind has created shadow impacts, and mental ill health has been one of those phenomena that Bhutan is dealing with, as are many, many other countries. So I think the first message is that Bhutan is not alone in having to tackle with this issue. But I also think we need to get a good sense of what it's costing the country because of mental ill health and disorders affecting people. I'll just give a snapshot of a global study that was conducted by the London School of Economics, looking at what the cost is to the world every year because of mental ill health and suicide amongst children under the age of 19. And the calculation, the estimate that the London School has given is that the world is losing some 380 billion US dollars a year. And by the time we reach 2040, that cost will escalate up to something like $420 billion. Now, that's a real call for us to make as strong as investment as we can in promoting mental health, promoting psychological resilience and well-being to prevent those losses economically. And that's something that I think is very possible to do in Bhutan.
There are lots of causes of the mental health issues in Bhutan, and the most prevalent here in Bhutan is the dependence on alcohol, psychosis, depression, and dependence on substance abuse as well. So what does these all tell about the status of the health in our country?
Well, I think it's important to recognize that mental ill health is not a manifestation of our health system. What it is it's a whole cultural, social, economic context that produces challenges to our mental health and resilience. And we are definitely around the world, because of the pandemic, seeing a definitive spike in mental ill health and problems that people are facing. But this spike may diminish as the economy improves, people get their employment back. So it's very circumstantial, and we must always stand back and say, how well are we investing in not just the health system, but a whole of society approach, a whole of government approach, which can build good health and allow us to respond quickly and early and effectively to any signs of mental ill health. So it's a continuum, and mental health situations in countries change over time depending on circumstances. And I think we've reached a point now in Bhutan where, with the right investment and the right decisions, which are being talked about right now, we can really turn the situation around and respond to the shadow epidemic that's spiking right now in the country, as it is all around the world.
Now, particularly talking about one of the causes, dependence on alcohol. Now, Bhutan is such a country where the dependence on alcohol is extensive, and the annual health bulletin 2021 also states that alcohol liver disease is one of the top killer in the country. So, does it have any relation with the mental health in the country?
I think the studies that are being produced all around the world, and I really would welcome studies here also if they haven't been conducted, is to examine that relationship between alcohol use and overcoming mental ill health and distress. I think it's fair to say that the studies globally are showing that there is a linkage between coping with stress and coping with distress, and alcohol is one of the escape avenues that people are using. So we really need to try and help people build resilience at times of stress to cope with everyday challenges and not fall into a trap where alcohol becomes a potential temporary solution to their distress. So that mental health promotion and building resilience to avoid the temptation to take alcohol to remove the stress is something that already is being put on the ground here, and I think we need to have more investment in those interventions, of course.
I think it is also equally important to look at the loopholes where we are failing. And I think if we understand this, it'll give us a way forward to plan, to reappropriate. So now the government of Bhutan spends 10% of the GDP to the mental health being of the population, and the health system in Bhutan is such a way that the government is spending a huge chunk of the government's GDP, but when it comes to the spending on the mental health, it is just 1%, merely 1%. Now, in 2019 and 2020 financial year, the spending on the health system was 8.7 billion ngutam, and just 1% of that to the mental health. So where do you think can we work smarter? How can we reappropriate this budget?
Promoting mental health and psychological well-being really must be one of a whole of government, a whole of society, a whole of life cycle approach as a country. So thinking that just the health sector has the responsibility and the mandate to address mental health and respond to mental ill health, best practices around the world have shown that we need to move beyond the health sector. Investments that are really going to be required in the health sector, the Lancet Commission for Global Mental Health and Sustainable Development has recommended, depending on the country's situation, somewhere between 5 and 10% of health spending should be on mental health. And the lower amounts probably in lower income countries, and as Bhutan progresses to becoming a middle income, then we need to be looking at a much higher level of investment just in the health sector. But I think it's really important that we seize the opportunity now to look at where investments need to be made in education, where investments need to be made in employment being a major intervention to promote mental well-being. We need to be looking at very strong primary health, community-based responses. We need educational settings to be whole-of-school approaches where children and young people are really having their mental health invested in, having the resilience and life skills to deal with everyday challenges. So really, whilst investment in the health sector can be increased, and we need to find that in that fiscal space to increase the investment, we're really calling for a whole-of-government investment, a united front in Bhutan to really tackle mental ill health and promote resilience and mental well-being. And that will require the whole of government to make investments.
Coming back to the coordination among the stakeholders, the linkages, studies have been done in the country, and it is suggested that there's a lack of linkages between and coordination among the stakeholders. Like, we don't have a good policy to tackle these mental issues, and we don't have a good legislation, and similarly we lack a lot of linkages between, as I said before, the stakeholders. Like, we don't have a good planning, a link with other sectors like education, transport, and then, like you suggested earlier, employment. So and housing. These are some of the important sectors that we could link these mental health issues. So, but here we don't have it. So, what would you suggest?
The work that is currently underway with the National Council's Social and Cultural Affairs Committee that is investigating and exploring the situation of mental health in the country is a really important step. I think the interventions that the Ministry of Health has already put up and has running, and of course it needs to be expanded and taken to scale. And I think in the education sector we're also seeing some fairly good initiatives there. But all of this, as you rightly point out, really requires a lot more coordination. Now, coordination doesn't cost too much. What the UN has proposed to the government, besides that economic investment case to explain what it's going to take to really improve the country's mental health profile, but also what are we losing. One of the other suggestions is that we should have really all of the actors in the same space at the same time. Immediately that will help create some of the synergies and the coordination mechanisms that are desperately needed. And I think everybody I've spoken to, and I know the National Council has also revealed that is one of the major bottlenecks, the absence of strong coordination. That national forum where all stakeholders can have a say, including representatives of youth networks and those who are facing mental health challenges, that would provide a good opportunity to discuss what are our short-term, medium-term, long-term investments that are going to be needed, what are some of the proven interventions that are working in Bhutan, what further research is going to be needed to identify new interventions that maybe are working in other countries that could be adapted here. So that national forum could be the start of a dialogue to create this coordination amongst the ministries, amongst civil society, amongst media, which plays a very, very important role as well, amongst religious bodies, amongst communities and schools, and amongst the children themselves. So I can see in all of the discussions we've been having with different stakeholders that everybody is asking for this improved coordination. And I think that is something that the country can definitely achieve. It proved it in the COVID-19 pandemic so successfully. I think that can be replicated to tackle mental health and promote it as well.
I think this problem, the lack of coordination among the stakeholders, has become quite chronic, I should say. Now, let alone the coordination among the stakeholders. I mean, looking at one agency, one stakeholder, it's very difficult to ascertain that, okay, this is working well. Now, education sector is one of the important institution where mental health can be taught, disseminated, advocated. But now here in Bhutan, what is happening is the schools in the country, we don't have enough counselors. We have one counselor for 1,000 children, and that is also not completely professionals. So looking at this, I think solving these issues in the short term looks very difficult. So what would you suggest so that these things, improves?
School counselors are only one part of the solution, and I think it's fair to say that there certainly needs to be more counsellors, and their skill level, as I mentioned, I think in the previous program, that can be elevated. And of course that's capacity building in terms of building counsellors who are able to not only detect but also refer, if necessary, the children. But I also think there's a way in which counsellors can be seen as mental health promoters rather than responders. And again, that boils down to giving them skills. I also think the country is gradually moving in the right direction in terms of thinking about mental health for children as a whole of school community initiative that must be put together. So from parents to the children themselves, to the teachers and the principals, if a whole of school approach is taken, and I've seen that myself in the country, and there are great models, for example, in Bihar state in India, where they have developed an approach that brings the whole school community together to help young people deal with some of the stresses, help the children look out for each other as well. And that has been scientifically proven to reduce levels of bullying, reduce levels of anxiety and depression amongst children and amongst the teachers as well. So I think a whole of school approach is not that much of an investment that can be made. It does require quality and commitment, but these are not sort of financial investments that need to be put in place. The numbers of counsellors could be increased, and I'm going to go back to the importance of showing what we're losing because we're not investing enough in the human resources, not just in the education sector, but in the protection and in the health sector as well. I'm also really interested that we've got some really good examples around the world of where children themselves in schools have been taught very basic psychological first aid. UNICEF is launching this year also I Support My Friends initiative globally, which is not just UNICEF but WHO and other partners coming together. And that has shown that when young people are equipped to detect certain signs in their peers and their friends, they can intervene not as professionals but as friends and peers who can then support their colleagues who may be facing difficulties get the help they need. And of course that is an intervention that can be brought at scale straight away into the country to build a whole generation of children who are looking out for each other as well as having parents and teachers support them.
I think to tackle these important issues, I think we need to have a lot of investments in terms of human resources, in terms of budget, and in terms of coordination. Now, from a very basic and a grassroots level, I think parents and teachers, the guardians and community play a very important role in advocating on these mental issues. But now, I think the system we have right now here in Bhutan doesn't seem to really work. So with this status and with the current education system, with the current advocacy system, the current system that Bhutan has maintained, what could be changed?
As I mentioned earlier, I think there's a new momentum, and COVID has revealed that every one of us is vulnerable to stresses and strains on our mental health. So all of us are vulnerable, and that has, I think, begun to open up people's thinking that we have to make a collective decision as a country, and partners are there to support whatever initiatives the government wants to take forward. But it has to be multi-sectoral, it has to have strong coordination, and we must invest in key workforces that should be on the ground in schools and communities, mobilizing all sorts of different actors as well, such as the religious bodies who play a vital role in supporting people's resilience. These are all on the ground in Bhutan and can be mobilized. You mentioned parents and the primacy, the primary role of parenting and how important it is right from the moment of conception all the way through a young child's life to early adulthood and beyond. Parents need a lot of support. Now, in 3 districts, in Punakha, in Shirang, and in Trashigang, UNICEF is supporting a piloting of caring for the caregivers, which is a package to help parents be better at parenting. And already, whilst the assessments are not formal, we're seeing signs of improvements in the way that parents are dealing and coping with stress, and not passing that stress on to their children, which of course is a major cause of mental ill health in children, is the domestic environment. So these are possible to scale up, and again, that economic investment case to argue for the need for this, take it to scale. It will benefit every single community when we've got parents who are getting support, and teachers who are getting support, and of course children themselves able to help each other. And then you've got all of these other actors that can come around, primary healthcare workers, the school principals, you can have the DESUPs and volunteers also playing a role, and of course religious leaders locally also are currently playing a role, and we perhaps enhance their skills also.
One of the observations by doctors, especially psychiatrists, is that firstly they don't really come across children, people who are suffering from mental illness because they don't want to show up because of the stigma around it. And secondly, when they really do show up, they're beyond treatment. So, looking at this situation, I think there's some gap between. So how do we identify such gaps and how do we solve?
Firstly, it's never too late to seek help. And I think our health system has been designed in such a way that we are able to respond to the people who are really suffering, even at a sort of a very delayed stage of identifying the issues. And that's really important that we maintain that kind of response system and perhaps even strengthen it with more human resources, more psychiatrists and psychologists in the country, and facilities that are able to cope. But that mustn't be the only way in which we deal with mental ill health. There are ways, simple ways, in which I mentioned psychological first aid. If that's given to community workers, to young people, we can pick up early the signs of distress and respond early. And the earlier we respond, not only is it much more effective, but it's also less costly. So I think it's really important that we understand patients who are really under tremendous mental ill health distress are often delaying that because of the stigma and the embarrassment also of their families and communities. So we also need to create a social dialogue to say it's okay to talk about mental health. It's okay to come forward and seek help, because the earlier we can do that, the better the outcomes for those individuals, and the less cost is involved in terms of the health system having to respond in such a sophisticated way.
Now, one of the statistics that shows about the trend of suicide in the country is that looking at the figure, looking at the occurrence, I think most of the suicide are occurring in the remote areas. Now, between 2018 and 2020, we had 283 suicide cases and 95 alone in 2020. So looking at this, I think we don't have a contingency plan in the local government, because grassroots level local government plays a very important role in advocating these mental health issues. So, but right now I think we don't seem to have one. So how could we really put this into place?
What's really distinct about the mental health challenges that are happening in some of these rural areas is it's very closely linked to some of the economic challenges that families are facing. When we think about what happened during COVID, we haven't seen a discernible increase in suicides. It's actually been the same annual number, more or less. But we must be very careful, because this data is generally around the world, data on suicide is underreported. It's often misclassified. There's no standardized definition across countries, so that we can't really compare different countries in terms of suicide rates. We need much better vital statistic systems in the country, and Bhutan is no different. So again, another area for investment. And of course, the ability to break the silence about why suicides are occurring. Whether it's related to a geography, I would be saying it's probably related much more to the economic conditions that families are facing, some of the challenges that we saw families having to deal with because of COVID, losing their employment. Then we see tremendous initiatives such as the Kidu system kicking in and helping. And I very much suspect that if we hadn't had His Majesty's leadership on that area, the mental health profile of the country would have been far worse. So people were enabled to get some income because of the Kidu. And that's something that we should really think about for the future, whether we need more social protection schemes that buffer families in distress, whether there's a pandemic or there is not a pandemic.
You shared a very disturbing statement last time that the mental health status in Bhutan is heading to the wrong direction. So I think this sounds a huge call out there to the relevant stakeholders to act immediately and to invest more. So can you tell us more about it, and how can we just turn it around?
Well, let me first clarify the statement. What we really need to pay attention to is where the statistics is showing us the direction, and that's a direction we can avoid. The situation seems to be worsening, and that's really a red flag to all of us, that we need to pay absolutely undivided attention to promoting mental health and resilience in the country. These can be done, this investment can be on a grand scale, the human resources required, but there are also very simple proven interventions that I mentioned are already being piloted in the country, could be piloted in the country at relatively low cost, and those preventive efforts are much more, have a bigger impact in the longer term. So it's not a huge investment that the country has to take, or a huge change in direction. What we need is to modify some of the interventions, put more emphasis on families and parenting and schools, for example, and above all, understand mental health is an asset. It's a positive attribute that if we invest in it, it'll pay back over generations. And this is that high-level forum that we have suggested, and the UN is very prepared to support such a forum, to bring all the stakeholders together to talk about how do we invest more in mental health and psychological well-being. Because if we can invest more, the country will head in a very positive direction. And I'd really love to think that just as Bhutan managed to be a beacon of hope for the region and the world, in fact, during the COVID-19 pandemic, we're not out of the woods yet, but everybody talks about what Bhutan did, and a very impressive national effort, a movement of sorts led by His Majesty and by the government. Let's replicate that for mental health. Let's be a pioneer, a role model for the region, stepping into that space where we have the interventions, we just need the investment, and our numbers that are heading in the wrong direction, we can change that. And I think it's very doable, and I'd love to think Bhutan can be a beacon of hope on the mental health front, just as it was because of the pandemic efforts it put in the ground here.
Doctor, very briefly, because this year's World Mental Health Day's theme is mental health care for all. Let's make it a reality. Your thought in the Bhutanese context, very briefly.
The UNICEF flagship report that's going to be launched also this year, The State of the World's Children, is entirely focused on mental health. And the message that UNICEF has to all stakeholders and government leaders all around the world is that we must start to break the silence on mental health. Too often, when we think of those two words, mental health, we already have a negative image in our mind. But as I mentioned earlier, mental health should be seen as an asset that we can invest in. And we have proven interventions here and in other countries that could be adapted here to break the silence. So as a nation coming around the table to discuss at high-level forums and involving district administrations as well in that, I think it's really possible for reality to be made on the ground here in Bhutan. And as I mentioned, if we can do that, I think Bhutan would be yet again a beacon of hope to tackle the shadow pandemic of mental ill health that has come upon us, hit a spike, but has always been with us. So now is the time to break the silence, have that conversation in homes, in schools, across communities, in all sectors of government and civil society. And I think Bhutan has already demonstrated to the world it can do the impossible.
A very insightful knowledge from Dr. Will Parks, the representative of UNICEF to Bhutan. And for your time, Doctor, we would like to thank you. And we hope that we see things going better. And today we brought to you this special program on this World Mental Health Day, and we are very happy that UNICEF supported this program. So I'm sure that you also had a lot of thinking from this conversation, and we thank you for watching the program.